I suppose I was reflecting a little bit on Deputy James O'Connor's contribution when he said that it would be the last for the year, and I suppose it makes us reflect on the year that we have had. Certainly the election in February seems like more than just a number of months away. We have had to tackle over that period two major issues, one being the impact of the virus itself, and I believe we have managed the virus well in this country, and I think the numbers and the comparisons with other European countries over these last few weeks has shown that we have managed this virus well. I don't think we should be triumphalist about that, and things will change over time. As the previous deputy says, the level of interaction you see around the city would cause some concern, and perhaps we are coming out of this second restricted period with a more relaxed attitude than we did coming out of the first restriction period. But all that being said, the numbers do speak for themselves, and we have managed this virus well. Secondly, I believe there has been a price paid for that by many people, an economic price. People have lost their jobs, people have been made redundant, people have lost income. But I believe, again, we have managed some of the worst elements of that economic impact with economic supports for jobs, like the CRSS, like the Restart Grant, and principally the PUP payment, which I believe is something we should look forward as being the basis of a progressive form of basic income. So I believe on that second score of managing the economic hardships, we have done well. And therefore I think it bodes well heading into this third phase now, where we will start to roll out the vaccine, that we equally should have confidence in this country's ability to deliver this vaccine programme. And I believe that should be matched, or should be summed up as two sides of a coin. On one side being the public support for that campaign, and on the other side, public service excellence in delivering that vaccine campaign. And there's a number of different elements in both of those points. On the public support, of course, there needs to be leadership. And we have to be careful that those people who believe, have genuine concerns about the vaccine, need to be won over. They need to be persuaded that their genuine concerns are genuine and can be answered. And they can be answered in a rational and reasonable way, and we'd explain why this vaccine can be another tool, like a face mask, like a 2 metre social distance. And we have to differentiate that conversation from those people who don't want to be persuaded because of an ideological opposition to vaccination, or they have taken an earlier position that they don't believe COVID is as serious as we do. Now, I don't know how the people in that category have come to that conclusion. In either of those categories, I think vaccine deniers and COVID deniers have their own form of twisted logic. The conversation with them shouldn't overtake the genuine conversation which we have to have with people who have genuine concerns. And so in the public health messaging, I would say, Minister, we need to make sure that we concentrate on the middle ground, on those people who have genuine questions, on those questions that we can genuinely answer, and that we don't get caught in a black and white argument with people who want that black and white argument. They don't want the sophisticated and nuanced answers. They just want to be COVID deniers. They want to be vaccine deniers. I also think in that public service, in that public support message, we need to talk about trusted advisors. We need to talk about GPs. We need to talk about our pharmacists. We need to talk about health professionals in people's families, to empower them with the simple messaging that this vaccine is an additional tool and that the vaccine will be crucial in us tackling the virus. The issue of certification, data protection and the technology around it is really, really important. But I don't think it should, the restrictions in that area, and there are always restrictions with any IT system or any data management system, it shouldn't dictate the ambition of this rollout programme. We do need to make sure that we record everyone that takes this vaccination. And if people wish to have some evidence that they have taken the vaccination, I think we need to make that available to them. But you know, a big part of this pandemic has been associating yourself with other people who you trust, people who you know are being responsible in this pandemic, and therefore you're willing to be part of their bubble, you're willing to trust them. And you know, I think that's how we're going to progress on the vaccine too. Because I know if I'm going to be with other people in a social setting, I'll want to be with people who I trust have also availed of the vaccine when they can. So I don't think we should be overly concerned about passports and certificates. It hasn't been the way this country has dealt with this crisis to date. There will be times when we need to provide evidence that you've taken the vaccine, and that should be available as part of the IT system and the administration system. But I think we should go back to the idea that in environments where we control and where we can have that level of trust, then we will not need that overly prescriptive approach. Of course, there are groups that are not in that position, where in their work they are put in a position where they live, they're put in a position where they're forced to be in environments with people who they may not have the information or knowledge to trust. And I welcome the prioritisation that has been given by the task force. And I have great experience of dealing with Professor Brian McGrath as a former president of DCU. He had great confidence in administering that university, and I hope he brings all that skill to the task force and all of the people on the task force. And looking at the prioritisation and the categorisation, it would appear that they are giving priority to small groups first and starting and expanding out to those people who can't control the environment around them, those people who live in congregated settings, those people who perhaps because of their housing condition or because of their health condition, they're forced to share space with other people, or those people who work in those environments to make sure that they can avail of the vaccine earlier than others. We saw with restrictions that there's always different focus being brought by different sectoral groups in what restrictions should apply and what restrictions shouldn't. And I imagine the same will happen with vaccination. But if we trust the prioritisation of the task force, then we can have confidence that they will deliver the programme to those people who need it most. I think that we then need to look at this definition of key workers, because I think it's really essential, Minister. And the one area that I would talk about most would be the area of education. Teachers and SNAs have put themselves in a position where, yes, social distancing is possible most of the time, but they are in contact with large groups of people, perhaps larger groups of people than most people have been. I would equate bus drivers in the same category, and other transport workers. But I think for teachers and SNAs to continue to have confidence that schools remain open, and they should remain open, and I despair at the constant rumour mill of schools possibly closing and not closing. The government has made a commitment to keep schools open as long as possible and as in as safe a manner as possible, and I wish we would continue to have that message rather than the constant attempts to shorten weeks and shorten times. But on that issue, if that commitment is being given, then equally we should stand by the teachers and the SNAs who are in that position. Of course, social distancing is possible some of the time, but there are occasions when it's not. My 11-year-old daughter very clearly said to me when I was asking her about the different conditions in her school, she says, well, you know, the babies can't keep the social distance the same as the rest of us. And that is the reality. Younger children in schools perhaps breach the distance more than others. So I would ask that key workers be examined and fleshed out, and I know every group will want to be in that category. That's the political reality, that there will be calls and lobbying from every group. But I think the education sector has been one of the real success stories of this pandemic, of how we've managed to respond to it. And I would like to see them and the risks that they take acknowledged in the vaccination programme. Equally, there are those people who have underlying conditions or who have medical conditions who will seek protection. And again, Minister, I'd ask you to examine them. But ultimately, this will be a case, and when you look at the categorisation, it's very clear. Although you might be category 7 or 8 or 9, actually the numbers above you are quite small. And that's because we focus the need most on those people who need it most. And as you get to each category, more and more people are brought into the programme, and therefore the practical realities of delivering the programme are there. That's going forward. I'll finish on the point by saying, I said at the beginning, the country had done well in managing the virus. We've done well in managing the economic impact of that virus.
Thank you, Deputy.
And I have confidence that we will do well again in
Deputy.
administering this vaccination programme.
Thank you, Deputy. Deputy Thomas Gold.